Hi everybody. We had technical problems, but we come back. I hope that you hear me again. I don't know if you hear me well before, but I am Dr. Jacqueline Osuna from Mexico Bariatric Center. I have 16 years of experience making this kind of surgeries. And for today, I have one surgery for today, and after that, I come back. I usually begin my day with some exercise. After that, answer my emails, talk with my kids, and after go to the hospital. Um, I'm going to respond uh, the, the questions that you have about your previous bariatric surgery or your next bariatric surgery. The question is, what advice do you have for someone considering bariatric surgery? Okay, this decision is about the patient, but I always review the health questionnaire for make an advice. It depends of the special case about the surgery that you decide to have. It could be a gastric sleeve, it could be a gastric bypass, it could be a single pore incision, it could be a duodenal switch, but it depends of the particular case. I always think that not all surgeries are for all patients. Okay. Um, Confused. I am booked for sleeve. Don't want revision, and people say bypass. I don't understand so well the surgery, the questions. But if you book an sleeve, I think that the surgery that you are going to have is an sleeve. But maybe there is a confusion in your health questionnaire. Maybe if you put that you have a previous surgery, it is the confused situation. Um, why did you become a bariatric surgeon? Okay, first, I'm passionate for the general surgery. You have to do first the general surgery, but I see all the problem that we have here in Mexico and in other countries about obesity. It's so sad. That is a very big problem in almost all countries. That's why this is a tool for help patients to resolve that situation. And one of the reason that I decide to do that is because I want to help patients for get a better life. Um, any reason to go mini bypass over Aaron Y? Okay, if the patient the results are similar between mini bypass and gastric bypass. The results are similar. The only difference is that in a mini gastric bypass you have only one anastomosis, and in the complete gastric bypass you have two anastomosis. If the patient have acid reflux, it's better the complete gastric bypass. If the patient doesn't have any reflux, we advise the mini gastric bypass. But the results are similar between them. Why do people have revision after a sleeve should just get bypass? The people could have a revision if the patient doesn't reach the goal, or if the patient regain the weight loss. We analyze the particular case, but in some cases you could have a revision. If you have acid reflux with a gastric sleeve, you could have a revision for a gastric bypass. And if you have a gastric sleeve that doesn't helps you to reach the goal, we advise to revision of a mini gastric bypass or a complete gastric bypass. I was the same. Bypass was recommended because of my reflux. Exactly. If you have the previous acid reflux, the best procedure for you is gonna be the gastric bypass because the reflux. If the acid reflux is frequently, it's almost all days in month, or maybe 4 days in the week, the best advice for you is the gastric bypass. I am 5 years post-op of gastric sleeve. I think I want a revision. Do a lot of people get revisions? It's not a lot of people. It depends how was the first procedure for you. If you regain, or if you don't reach the goal, we could advise a revision, but not in all patients is indicated. Could there be more complications with the gastric bypass? It's around the similar percent. It's around 0.02% about the risk. Only the gastric bypass is a little is more laborious procedure. It takes a little more time in the operating room, but the risk of complications is around the same. Okay, the question is, what surgery is best to prevent heartburn? I don't want heartburn or big baby hair. Okay, I told you before, I explained you before that if you have the heartburn, the previous heartburn or the acid reflux, the best procedure is gastric bypass, because normally when the patient doesn't have any bariatric surgery and the patient have acid reflux, it's indicated fundoplication. But if the fundoplication doesn't help to the acid reflux, the next step is the gastric bypass. That's why if you are thinking about bariatric surgery and you have acid reflux, the best procedure is going to be the gastric bypass. It is true weight loss after bariatric surgery for menopausal women is more difficult. In menopausal women, it's difficult to lose weight in general, but the bariatric surgery helps to change some hormone situation. It is more when you have the gastric bypass. That's why in menopausal women that needs a bariatric surgery, the best option, it could be the gastric bypass too. Anybody can pick a goal weight, but might not happen to us, not knowing how much we have the capability to lose. Preserve my my pre-surgery weight was, how much weight can I expect to lose? It depends of each procedure. For example, with the gastric sleeve, you are gonna lose the 70 80% of your excess weight. In the gastric bypass, you are going to lose the 75 to 80% of your excess weight. You are going to lose a little more with a gastric bypass because you are going to lose weight for two ways, because it's a restrictive procedure and malabsorptive procedure. But it's similar. If you see 70 to 75%, is similar to lose weight that you are going to lose. Some patients after surgery goes to the 100% of your excess weight, and other patients less than 70%. But the medium is the 75% of your excess weight. Okay. How do I know if I have a leak? What are the signs or symptoms? Okay, after the surgery, you are going to leave the hospital in Mexico Bariatric Center. You are going to leave the hospital knowing that you don't have any leak. Why? Because we made 3 leak tests. One is in the operating room. The other one is the second day after surgery, that you are going to drink a blue water, and the final test is gonna be that day, and it is gonna be the fluoroscopy. After the fluoroscopy, we are sure that you don't have any leak. That's why you are going to leave the hospital with the knowing that you don't have any leak. Once you are in your at home or in your country, you could develop a leak if you don't follow the nutritional instructions. That is so important, because in that moment your stomach is healing. That's why we begin with clear liquids after surgery. And if you follow the steps after the bariatric surgery about the nutritional instructions, you cannot develop the leak, because after the surgery we are pretty sure that you don't have a leak. But after that, the only thing that you have to do is follow the nutritional instructions and don't advance and another step that we indicate. The symptoms after a leak is, it could be pain, it could be a fever, it could be the heart rate is gonna be up, and you are going to feel bad. That is the symptoms. Okay. I'm looking for the questions. Okay. The question is, I did regain half my weight. I am on Ozempic now, so I don't regain anymore, and it's helped me to lose what I gain. What I gain, but I don't want to be on Ozempic for a life. So would your vision the best? Yes. Okay. The Ozempic and the medications related to Ozempic are good to some patients, but are medications that you have to take for a lot of time if you have to keep the lose weight. In some patients, they can take that medications for the symptoms or for the complication about the medication. In your case, it could review that you maybe you could have a revision about your surgery, and give you, if you have the gastric sleeve, maybe we could add a malabsorptive procedure, and it could be the best option if you don't want to have that medication for life. When you don't lose a good weight after Ozempic after 3 months, maybe you can't lose more. And in that case, the best option it could be a revision. The best. What I expect when you wake up from surgery. Okay, the first thing maybe you're going to have you are going to be dizzy. You are going to be dizzy. You are going to be have a little pain, a little sore. But after surgery, it's like another laparoscopic surgery. It's not so different from another laparoscopic surgery. The sensation after the surgery. The best thing that you can do after any laparoscopic surgery, in this case is the bariatric surgery, is move earlier, because most of the pain that you are going to have after surgery is related with the remaining gas. If you begin walking, if you begin moving, you're going to feel much better at night if you walk during the day, but it has to be constantly. How will I? How many days after surgery to recover? The first day after surgery, the first day is the worst day, but 24 hours after surgery you are going to feel much better. And if you are talking about how many days to return to work after bariatric surgery, the advice is to is it depends about your work, but it's to 1 week to 2 weeks. The most indicated is 2 weeks, because you are going to feel you are going to be ready to do almost everything after 2 weeks, except to lift and to push heavy things. Okay. How will this surgery affect me when I am older? I think that you are not affected about the surgery. It's it's more that the benefit that you're going to have after surgery, because you are going to prevent the chronic diseases, or if you have the chronic diseases, you are going to help to control that diseases. I think that the question, you don't have any affected when you are older. Okay. How often should I weigh myself? The advice is to weigh every week or every 2 weeks. The advice is not to do it before, because some change in your weight are about liquids, about medications, and maybe you are going to feel bad if you don't see results in the when you see the weight. That's why the advice is to weigh you every week or every 2 weeks. Okay, have a look. The heartburn. Huh? No? No encuentro otras. Okay. Okay. The question is, I am in blue thinners while I need to come off of surgery. Okay, if you are taking, it depends of the blue thinners that you are taking, but if you are taking, for example, mm, Lovenox. If you are taking Lovenox, you have to take off 1 day before surgery. But there is another kind of blue thinners that you have to stop 7 days before surgery and switch for Lovenox. And the Lovenox has to be stopped 1 day before surgery. But it depends on the blue thinners that you are taking. That is important in the health questionnaire to put that information to give you the best advice. Yeah, the question is why people need a revision when surgery is supposed to work in the first place. That is a very good question. Uh, we always try to advise the best surgery in the first stage. That's why I told you before that not all surgeries are for all patients. The important first decision is related with the successful of the surgery. If we advise the best procedure for each patient, the revision is going to be less in the future. That's why when you maybe ask for a sleeve and the surgeon told you that the best procedure for you is a gastric bypass, listen to the surgeon and this explanation about the situation, because the first surgery, it has to be the successful surgery. We prefer don't to do the revisions, but some patients need a revision because the first surgery doesn't help to reach the goal, and maybe after the patient regain weight. Do we see our regular doctor for our wounds after we get back home? Yes, you could go to a regular doctor, but if you have questions about your incisions, about your healing, we are always open to receive your pictures and your questions, and we're going to give you the advice about your incisions of your wounds. Okay, the question is, how can I determine which surgery is better for me? Okay, when the patient sends the health questionnaire, the patient put the surgery that they are interested. I always review all the health questionnaire. It's important the age. It's important if it's female or male. It's important the chronic disease that the patient have, the background about the family, and the habits that the patient have. Once I review the health questionnaire, I advise the best procedure for the patient. The final decision is taken for the patient, but I always make an advice if it's different for the surgery that the patient is asking. But I think we could have a communication for make a good decision for the patient and prevent the regain weight after the first surgery. If I had my gallbladder and appendix removed, do I still qualify? Yes, we don't have any problem about that kind of surgeries. You are qualified. It doesn't qualify if you have the previous surgery. Are there any long-term or short-term complications with having the vertical sleeve gastrectomy? Okay, yes, the short-term complications, it could be the bleeding, it could be the leaks. This is the more important complications. obviously, when you leave the hospital, when you leave the country, we are sure that you don't have that short-term complications because we, like I explained you before, we made 3 leak tests and we are sure that you don't have any bleeding before you leave the hospital. The long-term complications, it could be related about the following instructions that we give you. For example, the don't advance one from a step of the clear liquids to the general liquids. If you are not prepared, don't advance to the other stage. Or for example, some people ask about the increase of the stomach after gastric sleeve. It could happen, but it could be a long term. But it only happen if you put in your new stomach to a high pressure. What does mean? If you drink and you feel pain and you keep drinking, you are putting your stomach in a high pressure. That could distend the stomach, and it could be related with a increased stomach in maybe 3 or 5 years after surgery. If that happens once in a month, there's no problem about the increase of the stomach. But if you do it constantly, if you put your stomach in a high pressure constantly, it could happen, but it's not frequently. Okay. Are the liquid vitamins better? The question is, are the liquid vitamins better on your stomach? It's the same, only the liquid vitamins are indicated for the first steps of the surgery. Why? Because your stomach is healing, and your stomach in the first weeks are not prepared to big pills. That's why in the first stage we advise the liquid vitamins, but at the same in the absorption. After the first month, you could take the pills without problem. Can I get a gastric sleeve at 10 pounds? 200 pounds. It depends of your height. It depends of your height and your and the BMI. It's not only the pounds. It depends on the relation of the pounds and the height. What is the recovery period like? And how quickly after do I start to shed pounds? Typically. Okay, the recovery period, it depends of the work that you do. Normally, after 1 week of surgery, you could be able to make all things except lift and except push heavy things. After 2 months, you could lift almost any kind of pounds, but it has to be after 2 months, because we have to prevent the abdominal hernias. That's why about the lifting. Okay. We will need a revision. Okay. Do you do mini sleep? Yes, I do mini sleep too. It's another procedure that I make. Are you able to do an IV infusion therapy session after surgery to replenish hydration? Yes, there is no problem about the IV infusion therapy after surgery. Normally, when the liquids that you take, if you keep the intake constantly, you don't need the session, the infusion therapy session. But if you want to do it, you could do it without problem. Do I need a companion? It's not a it's not a rule. We advise to come with someone, but if you can't, it is not a rule. You could be here alone. We are going to be with you all the time. If you can't can come with a companion. Yes, can you talk about the mini sleeve? Okay, the mini sleeve, it's the same about the sleeve, about the inside surgery. The only difference is the approach. The approach in mini sleeve is for three incisions. Normally, the sleeve have 5 incisions, and the mini sleeve it's about 3 incisions. Not all patients are qualified for the 3 incisions, because some patients that have a very big BMI need a retractor of the liver, and in some patients with a big livers we can make a mini sleeve. It's the only difference, but the surgery like itself is the same about inside is the same about the mini sleeve and the sleeve. Huh? Okay. The question is, it is true that carbonation can okay, sorry. It is true that carbonation can make your stomach stretch. No, carbonation can't stretch your stomach. The only thing that can stretch your stomach is the surgery. Even the balloon and the gastric band can stretch your stomach too. Only the surgery like a sleeve or gastric bypass or mini gastric bypass could stretch your stomach, but not the, the carbonation. Dr. Osuna just did my sleep. Very happy with her work. Thank you so much, Tanya. Okay, I think it was the last question. It was a pleasure to be with you. I hope that I could answer the real question, and if not, send us a message and I want to try it. Have a good day. Thank you.